Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Melissa Hritzik. We have a lot of healthful news you can use in this episode, including you don't have to go it alone with a diabetes diagnosis. Stay tuned to learn about specially designed help to manage the disease. Joint replacement surgery doesn't necessarily mean a lot of post-procedure pain. You'll hear from a local expert about his nearly pain-free protocol. And you'll find out about a simple screening that is credited with diagnosing deadly lung cancer. It is Heart Month, and one Lake County hospital is adding new services to help care for hearts across the region. The cardiac care team at Florida Hospital Waterman is excited to offer minimally invasive valve surgery.
We are going to be able to offer quite a bit of exciting things in heart surgery coming in the near future. Already we were able to perform mitral valve repairs and complex repairs. We think that's very important because patients with mitral valve disease can frequently undergo a repair rather than a replacement. The heart function remains better, and whereas nationally only about half of mitral valves are being repaired, we anticipate being able to repair 90 to 95% of them. In addition to the basic problem of dealing with the mitral valve, we should be able to offer many patients minimally invasive valve surgery for both the aortic valve and the mitral valve. We should be able to provide everything short of transplants that they need here.
Dr. Moore, a board-certified cardiothoracic surgeon with more than 20 years of experience doing heart surgeries, says if you or a loved one faces a heart procedure, it's important to vet your specialist.
Quite frankly, one of the best ways to pick a surgeon is word of mouth and reputation. And that is frequently the way that I and my family choose physicians. I think one of the first things that you have to determine about your surgeon is to make sure that they're board certified. That gives you a confidence that they have met a minimum standard of training and expertise. When you're talking with the surgeon, it is beneficial to find out what their experience is in your particular problem and find out if they've done a large number of cases of the type problem that you have and what their results have been.
Recently, the public had the opportunity to see some of the advanced cardiac technology used locally up close. The Biomed Mobile Learning Lab made a stop at Florida Hospital Waterman. The traveling showcase offers hands-on learning experiences, interactive displays, and the chance to speak to experts about state-of-the-art technology. A highlight of the lab is the demonstration of the Impella heart pump, which assists in the recovery of patients who have suffered a heart attack. After a heart procedure, it's common for a specialist to prescribe cardiac rehab.
Cardiac rehab is essentially an American Heart Association prescribed physical therapy recovery plan that I think most heart programs subscribe to, essentially the same program. It puts them in a monitored environment so we can kind of understand not just what are their abilities, but what are their goals and how do we safely elevate them.
I had 3 stents put in, and I feel wonderful. Right after he had put the stents in, I was able to breathe again comfortably, and all was going well. And then he sent me to cardio rehab. You go 3 times a week, Monday, Wednesday, and Friday. And when you first start out, they start you out on exercise machines, bicycles, treadmills, other machines that I was not familiar with, but that I really enjoyed working on. And then they start you out very slowly. And then as the weeks go by, they increase it until you have reached the capacity where they feel that you are capable of doing better and feeling much better. And they're monitoring your heart while you're doing this, and they're also checking your blood pressure to make sure everything's okay.
As far as what intensity they need and for how long, it's also very individualized. So if we're trying to get someone, say for example, to walk a mile a day, some people get to that very quickly, but I would say in general, the average amount of outpatient cardiac rehab is anywhere from 4 to 6 weeks.
When I first started the rehab after I had the stents put in, I went on to the treadmill, and the first time I was on the treadmill, I couldn't even stay on for a minute because I was still experiencing some shortness of breath. And by the time I left, I was like practically power walking on the treadmill, which was a tremendous, tremendous improvement. So it just gives you a boost of energy and helps you to heal faster. So I would recommend it to everyone. I have found that it's a big commitment, but it is worth it. And the staff at the rehab center is wonderful.
You'll find a number of local resources on the website fhwatermanheart.com, including a library of educational videos related to heart health. Next, local medical experts are hopeful about a national study which points to a common screening process for helping to identify deadly lung cancer.
The overall incidence of lung cancer is very high in the United States. 20% of Americans are smokers. In fact, that the results of treatment for lung cancer are so disappointing, it's actually the #1 cause of mortality from cancer in the United States. And what this long-term study has shown is that CAT scans, the newer thin section CAT scans that we use here at the Center for Medical Imaging can detect cancers before they become advanced, when they're still very, very treatable. With an order from the physician, you will find that your insurance, whether it be with private insurance or Medicare, will cover the cost of the screening. And what it entails is a ultra low dose CT scan. So the radiation dose is very low. There's no IV. It's a lie down on the table, and in less than a minute we get the scan done. And it's a very easy, simple procedure.
Pam Koster's doctor was concerned about her persistent cough.
First I had an x-ray, and then they saw something. And then from there I went to a CT scan, and then that's where they actually saw I had a mass on the left upper top of the lung, and then multiple spots inside the lung on both sides. And plus a spot on my liver. I had quit smoking, and it has been about 20 years since I've quit. Since I've been diagnosed, I've done a lot of reading, a lot of research, and found out that they claim that lung cancer, even if you quit smoking, that usually 15 to 20 years after you quit, the cancer shows up. And that's about the time that, it's been 20 years since I quit smoking.
The team of experts at Florida Hospital Waterman Cancer Institute designed an aggressive chemotherapy treatment plan for the Tavares woman. They monitored her progress with additional scans.
I had scans, and the first scan was very encouraging because the growth had shrunk and the little spots had started to disappear. The one on the liver totally had disappeared. So right away I had excellent results from the chemo. And so then each time that, I think it was like every 3 to 4 months, that I would have a scan, and it was better. Each time it was better. They have been wonderful. They explain everything. They explain it and ask, do you understand? Is there any more questions?
You can learn more about the extensive services for diagnosis and treatment available here in Lake County by visiting fhwatermancancer.com. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. A Tavares surgeon explains why his joint replacement patients leave the hospital nearly pain-free. You'll learn about a 5-session course to help diabetes patients manage the disease. And you don't have to say no to chocolate. We visit the Con Recreation Health Center kitchen for an explanation. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. You might want to check out these upcoming community events. Don't go away. Waterman Wellness will be right back. Only you can point yourself in the right direction to a happier and healthier life. Today, commit to live by the principles you believe in. Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Alyssa Hritzik. people who suffer with joint pain may wonder when it is time to do something about it. They may be concerned that surgery will lead to more discomfort or limit their activity. The pain in his knees that Michael Ahern of Leesburg experienced was impacting his quality of life.
The first thing they did, they took x-rays of my knees. He looked at the x-rays and he said, okay, you need 2 new knees. I asked about a partial replacement and he said that I was not eligible for that, that the knee was too far gone.
Ahern sought relief from Tavares orthopedic surgeon Donald Perry. Perry recommended Ahern for advanced Mako robotic assisted knee replacement surgery for both knees. Dr. Perry also utilized a pain management protocol to ease Ahern's recovery.
The pain-free joint procedures is something that I probably started to develop probably 8 or 9 years ago, and this is a part of it. But basically, even with my knee replacements, partial knees, hip replacements, shoulders, we have a pain regimen that we do, and we start 2 hours before the surgery. There's different techniques we do during the surgery, and after the surgery we have a certain protocol that we put people on. And so we are proud of the fact that we've had some of the lowest pain scores in the hospital for several years. You know, when I first started doing this years and years ago, people just had the fear, well, I don't want to have something done because this is going to be too painful, and we're trying to change that.
I mean, when I left here, I mean, I could walk. There wasn't a tremendous amount of pain. There really wasn't. I can do whatever I want to do. I mean, would I want to go ice skating? Probably not, but I can run, I can jog, I can ride a bike.
Visit fhwatermanortho.com to learn more about the relief options for joint pain sufferers. A local hospital wants Lake County residents diagnosed with diabetes to know they have plenty of resources locally.
Here at Waterman, on any given day, about 35% of our patients are diabetic. I feel like the diagnosis of diabetes is devastating to someone. It really changes their outlook on life. Someone who formerly thought that they were really quite healthy, all of a sudden are diagnosed with a chronic disease with lots of long-term side effects, which we have heard terrible stories about, many of us, for our entire lives.
Dudley says education plays an important role in helping diagnose patients, and even those predisposed to the disease improve their health and avoid potential complications.
If you do have the genetic predisposition for type 2 diabetes, it would be much better to develop healthy lifestyle habits and be diagnosed in your 80s than it is to be diagnosed in your 50s, because there's a lot less time for damage to occur to the heart and the blood vessels.
A diabetes self-management course is offered throughout the year and includes information to help patients understand diabetes, manage carbohydrates, plan meals and exercise, monitor blood glucose, and manage and prevent complications. The cost of the 5-session course is $35.
I can tell you in other places, it is often a $1,000 charge to attend that same class, because I've taught it for 30 years in other places. So it's a great deal, whether you're newly diagnosed, whether you're out of control, or whether you're just changing to a new mode of therapy, or maybe you just need a little push in the right direction. It's a great class for everyone.
A year-round diabetes support group meets the first and third Wednesday of each month. The discussions are led by a certified diabetes educator and registered dietitian. Participation in the support group is free. Visit the Con-Recreation Health Center website for information about education and support resources for diabetes patients. Next, chocolate may seem like only a dream for a person with diabetes. Michelle Wargo is in the Con-Recreation Health Center kitchen, where the Florida Hospital Waterman team explains that some chocolate can be healthy, in moderation.
If you're like me, anything chocolate is just the thing to get your heart racing a little faster. So that's why it's so wonderful that Florida Hospital Waterman Executive Chef David Atkinson is here to share with us a recipe that will impress the love of your life and is good for your heart. And Stephanie Bassett, registered dietitian Stephanie Bassett, is here to tell us why this is good for our hearts.
We're using dark chocolate today, and dark chocolate is a really great source of antioxidants.
Fantastic. So, what goes into this? Not much, it looks like.
No, this is as easy as you can get, really. We set up just a pan of boiling water with another bowl on top. And we're going to put our dark chocolate in there to melt. This is a 72% dark chocolate that's available pretty much anywhere, your local grocery store.
Oh wow, it's already melting.
And then as soon as this gets melted, we're just going to dip our fruit.
So, Stephanie, why is dark chocolate better for you than milk chocolate?
Milk chocolate has no antioxidants in it whatsoever, and dark chocolate has a lot of antioxidants, and the higher the percentage of cocoa, the better it is. You want to at least buy 70% dark chocolate, and they have anywhere up to 100% as well.
And that's a really bitter though.
Very bitter, yes. But if it's over 70%, it's going to have a lot of antioxidants in there. The serving size is very small though. You only want to have about 1 or 2 ounces. 1 ounce would be about the size of a Hershey Kiss.
So at this point, our chocolate's melted. You can see that was very quick.
Quick, really quick.
We have a dried mango, a dried apricot, fresh strawberries, and fresh bananas that we're going to dip.
So do you think that they've cooled enough so we don't burn our tongues?
Oh, you can sample one, sure.
I'm gonna try the mango.
You'll find the recipe for the fruit and dark chocolate by visiting watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the March episode right here on Lake Sumter TV for some of the following stories. You'll learn how minimally invasive imaging guided procedures are being used locally to diagnose and treat disease. A Tavares specialist shares important information about the detection of colon cancer. And the Con Recreation Health Center team will demonstrate an easy dinner recipe that's good for your digestive health. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Melissa Hritzik for the award-winning Waterman Wellness.